Whoa. Well, good evening, everybody. I'm Dave Moorhead. I'm the Chief Medical Officer at Florida Hospital, and I've had the privilege of working with John Guarneri as we've tried to mature the Med Staff Department of Healthcare and Spirituality, working with our physicians. And in this Creation Conference Center in the Tom Werner Auditorium, which we actually have a Tom Werner here in his own auditorium tonight, we've had a host of presentations of people from different faith backgrounds. And I see some of our three wise guy friends here tonight. We've had a Protestant minister, a Jewish rabbi, a Muslim imam, and tonight we have the privilege of having a Buddhist monk. Florida Hospital is a really interesting and fascinating place for many reasons, but one of the things that makes it so interesting is that it is an overtly Christian Seventh-day Adventist institution. If you see our images in the hall, if you look at our mission is to extend the healing ministry of Christ, we are an overtly Christian organization. But we are populated by people from every faith, culture. We are populated by patients who come from around the world. And as we try to understand our patients' spiritual needs, it's become clear to us that our fundamental assumptions many times are not consistent with what they understand as their culture. So we want to understand the culture of our patients. We want to understand their faith background so that we can be overtly respectful and supportive when they're in our institution in a time of need. We also want to support our physicians, and we have physicians from so many different faith backgrounds who bring their own culture into our institution, and it's imperative that we understand. And so I hope that word tonight, understanding, is a key as we listen to someone with a deep spiritual background in the Buddhist tradition. What makes him incredibly interesting, too, is that he works with the Dalai Lama, who many people across the world see as such a positive figure. As we listen tonight, I pray that we will do a better job of understanding the unique spiritual aspect of each of our patients. Now, as I watched this coming in, I watched Dr. Kerzin coming on, I saw a unique assumption that we are not experienced in dealing with, and that as people who have lots of pockets, where does a Buddhist monk put his microphone? And so I saw that he was obviously very pragmatic and dealt with that. Greg Ellis from our Pastoral Care Department is going to ask a blessing on this meeting, and then John Guarneri, who directs our Healthcare Spirituality Program, will introduce Dr. Barry Kerzin. Greg?
Thank you. Will you bow your heads with me as we pray? Dear Lord, we thank you for the opportunity to gather this evening. And we come together tonight recognizing our common calling to serve the needs of our fellow human beings with the love and compassion that finds its ultimate source in you as our Creator and our God. And tonight, Lord, as we explore what it means to care for the whole person, perhaps from perspectives and views that will be unique and new for us to experience, I just pray that your spirit of love and grace will fill our hearts. May we truly learn and grow in our understanding together this evening. Bless our presenter, Dr. Kerzin, and each of us as participants as we seek to deepen our commitment to truly serve the needs of others, is our prayer in your holy name. Amen.
Thank you, Greg, for that. Well, I also want to welcome everyone here this evening, and I have a few words. Dave touched on a point that I think is really important, and it really is epitomized by the three wise guys who are here tonight that I'd like to recognize. Brian Fulwida, Reverend, Steve Engel, Rabbi, and the Imam is still fashionably late. Yeah. Yes, that was very good, Dave. But what they are and what they do and how they've started as far as they first got together because they wanted to understand each other better from very different religious perspectives. And from that deep friendship that evolved, they said, we have to do this to our community. We have to get it out. And it's something as a Christian that, and I am certainly embedded in my religion, but I realize the importance of being ecumenical about this as well and understanding people, especially within our profession where we're dealing with folks from very different reference points. So I thank you, and you inspire me for what you do with that. As we now go forward, there's one other recognition I'd like to do, and that is the Winter Park Health Foundation that has co-sponsored this event as well, so I thank them for that. Let me just tell you a little bit about Dr. Kerzin. He has had an incredible walk in his life, and I would just like to share a small part of that. First of all, he went to the UC Berkeley for undergraduate, got a degree in philosophy. I'm sure that was a good ground for him as he began to evolve. Subsequent to that, he was at USC and did medical school there, did a residency in family medicine, and then subsequent to that, he was at the University of Washington as an assistant professor within the family medicine department. He then took an interesting turn. In fact, he's been in, correct me if I don't say this right, in Dharamsala, India, for the last 25 years. While there, he was ordained a Buddhist monk by His Holiness the Dalai Lama, and also became the physician for many of the High Lamas, including the Dalai Lama himself. He also has dedicated himself with helping the poor. He actually gives his time in medical care to many of the folks throughout, mostly in India, Barry, or yeah. In addition to that, he has lectured and been part of many universities, specifically the Central University of Tibet in India, as well. Most recently, just this past month in February, he was in Hong Kong University, talking mostly on compassion and ethics. So, without further ado, what I would like to do is if you could help me give a warm welcome to Dr. Barry Kerzin.
Thank you very much. Well, it's lovely to be here. Actually, that's very true. 3 nights ago, where I was, it was minus 21 degrees. And 2 nights ago, a group of us went out to have some Italian food, and we were in the restaurant an hour and a half, maybe. We came out, and we couldn't see our car. Literally, it was covered with snow. All we could see was snow. That was in Rochester, Minnesota. So it's very nice to come to Florida. Thank you. This is not my first time. I think it's, where are we now, 4 or 5? 4, maybe my 4th visit to Orlando. And starting to make some very, very dear friends here. And that makes it a very special place for me to return to. Tonight I'm going to talk for maybe 20 minutes. Okay, I've got a few slides that I'll show you, and then that's kind of we'll get that behind us, and then we'll do the fun stuff. Okay, and the fun stuff is going to be I'd like to meditate with you. Okay, we'll do a short meditation. I'll take a couple minutes to explain exactly how to do it. And then we'll meditate together for a short period of time, 5 minutes or something. And then we'll have if I'm efficient with my time, we'll have still a little block left, 15 minutes-ish at the end, and then we can open it up and we can talk together, okay? You know, we have these wonderful 3 wise guys, but we can be, you know, 50 wise guys also, talking to each other, making comments, asking questions, whatever you like. And then we'll try to finish just about 7, I believe. Is that correct? Okay, very good. Didn't hit it hard enough. There's a right arrow and a left arrow. And I spend a lot of time in India where they drive on the left side of the street. I just came from Hong Kong, which was, as you know, formerly British, left side of the street. I go to Japan a lot, left side of the street. In America, it's the right. So I often am having trouble knowing which side of the car to get in. Sometimes I go to the driver's seat and, oh, you want to drive? Oh, no, sorry, I made a mistake. Okay, so this is functional fMRI. I have a couple slides about research that's been happening for the last 10, 12 years on meditation. Okay, and this is a study that I participated in Wisconsin, University of Wisconsin-Madison. Dr. Richard Davidson and his group. And they looked at people that have a lot of meditation experience. 10,000 hours was the bottom limit. Some people had 40 to 60,000 hours of meditation experience in their life. And they looked at them with 3 basic methods. One was MRI, as you see in the background. I'm sitting there after 2 or 2.5 hours in the scanner. And if you're claustrophobic, it doesn't work. But it was actually a joyful experience. And then EEG, and I'll show you a slide with the spaghetti coming down my head. EEG leads, electroencephalograph. And then thirdly, with some psychological testing, primarily something called the attention blink. If there are any psychologists here, you know what that is, or neurologists. You know that that kind of measures, there's a, once we see something, there's kind of a period where we're kind of blind, if you will. We can't recognize something else. And that interval is said to be, I don't know the exact numbers, it's somewhere around, I think, 400 milliseconds for, normal folks. So we're blind for a half a second about. With long-term meditators, actually, that blindness is much less. So attention is greater. But I just wanted to show you the MRI, and I wanted to show you this one. What they're looking at primarily, what they're finding in long-term meditators, is a difference in the prefrontal cortex. And this green is the prefrontal cortex. So just the very, behind the forehead, basically, our cortex. And this is an interesting area. It's more well developed. Yeah. I don't know. My English sometimes fails me because I live in a lot of different countries, and sometimes my English gets colored by the country I'm living in. So the prefrontal cortex is very interesting because it kind of controls some of the highest levels of our cognitive, of our thinking, our cognition. For example, planning, reasoning, imagination. But not just that. Also, empathy. This is not the only place in the brain, but it's an important place that regulates our empathy, feeling how it is, how another person is feeling. That's what empathy is. Self-perception. This is a bit controversial. Some people believe no, but most people believe some sense of differentiating ourselves from others happens in the prefrontal cortex. The ability to interact well with others. So all this is prefrontal cortex activity, and that's improved, enhanced in long-term meditators. That's what they found with the MRI sort of work. Then they looked at EEGs, electroencephalograph, and there's somebody there that's got this draped on them. That was me a few years ago. And actually, I was meditating there. Probably I was sleeping, but they told me to meditate. My eyes are closed. Usually I meditate with my eyes open, so I don't know. And what they found were these, what we call gamma waves, okay? Those people that, work with EEGs know that in a normal person, gamma waves are quite rare. This is not epilepsy. These are not epileptiform, epileptic kind of activity. This is a normal EEG, and then I put here T0, time start, and then I said stop. And basically that represents when we were in the, hooked up to the EEG, they told us to start meditating. There are actually 3 different types of meditation that we were doing at different times. But when we were told to stop meditating, the EEG reverts back to a normal pattern. And these occur throughout the cortex, front, back, right, left. So this is a very unusual phenomenon. And it does not occur when the long-term meditators are not meditating. Okay? And the control group, who are not meditators, obviously when they're taught a little meditation and when they're told to rest, not meditate, you don't see these bursts of gamma waves, these high amplitude, high frequency. What does it mean? They don't really know. But what they're hypothesizing, some sort of synchronicity across the cortex. So when we all went to medical school, or to health professional schools, we learned that maybe a millimeter or 2, maybe, cortex could kind of communicate, talk to each other. But this is actually suggesting maybe it's much more global across the whole cortex. Still not, definitive, but that's what the neuroscientists are, how they're interpreting this data, at least at this point. There's a tremendous increase in interest in meditation research. And here you have numbers of publications, here you have the years, and you can see in the 1970s there was a little blip up to about 200 publications. The research was not well done. It was not published in the best journals. Nevertheless, this is the stuff done on transcendental meditation in the 1970s. And then you have another kind of rise from the 1990s, beginning of the 1990s. And this doesn't go up to 2014. Now I believe we're over 1,000. But there's been an incredible interest in the science, particularly the neuroscientific community, in researching meditation. This is a technical slide. I didn't put this together. A dear friend of mine did, who's one of these researchers. And this is about depression. And basically what it's showing is if you don't do anything, so-called placebo, you don't get very good results in terms of reducing the depression, the symptoms of depression. On the other hand, if you give antidepressant agents, you get a reasonably good effect, okay? But what's really interesting here is if you provide the patient, the person, with a mindfulness-based cognitive therapy, so-called MBCT, and some of you know what that is. Mindfulness is a way to stay in the present and to be aware, particularly of the internal things that are going on inside of us, such as the sensations in the body, such as our thoughts, such as our feelings. So being mindful just means learning techniques to be more in the present and turn inward, observe what's happening in our body, our heart, our mind. Okay, that's mindfulness. CT, cognitive therapy, has to do with a standard kind of, psychological intervention, which uses, kind of cognitively to sort of change the patterns. So we get stuck in these records, emotionally, to try to change the record cognitively through our thinking. So this is a unique type of new therapy which involves mindfulness, and that's a type of meditation. For those of you that, the word meditation, you're kind of, oh, what's that? You can call it mind training, because that's what it is. Okay, it's a way to train our minds in a positive sense. So what really the results of this research, and this is from 2010, published in the Archives of General Psychiatry, is that mindfulness-based cognitive therapy, a type of meditation, if you will, and SSRIs, antidepressant medications, the benefit to the patient is equal. No side effects with meditation. Side effects with this stuff. You guys know about that. This stuff is costly. You know, insurance companies don't pick it up fully, I believe. This stuff is free. Okay? So this is just one of the areas where meditation is beginning to seep in to medicine in terms of what we offer the patient. Now, here are a couple other areas where this kind of mindfulness or meditation, which we'll do in a few minutes together, look at my time, is beginning to be useful and helpful. And these are new studies. For example, stress, anxiety, and depression. Anybody here never have stress, anxiety, or depression? Raise your hand. If you've never had it, raise your hand. I'm just being a model. I can't raise my hand. Okay, we all have it. This is part of life. Okay, particularly modern, stressful life. We all have it. Okay, so what about that? So cancer patients benefit, that is, they get a reduction in stress, anxiety, and depression through mindfulness-based or meditation-like practices. Not only cancer patients, this is from Hoffman 2012, but child abuse survivors, similarly, reduction of the stress, anxiety, and depression. Also, anxiety disorder patients, depression relapses are reduced. Siegel is one of the very important people doing this kind of research with depression from 2010. Also, in terms of reduction of symptoms of chronic inflammatory diseases. Wow. How could that be? Well, we have some ideas, and if we have time, maybe later we can discuss some of those ideas, what the connection might be. In fact, I will discuss that. Where's Scott? Scott, are we okay? I just moved my outer robe, and I heard a little rumblings there. Okay. So for chronic inflammatory diseases, arthritis, diabetes, not quite chronic inflammatory, but maybe with the pancreas, psoriasis, and chronic pain. Okay, all improved, symptoms improved with meditation or mindfulness practices. And addictive behaviors such as substance abuse and OCD, obsessive compulsive disorder, symptoms improve with this mindfulness-based kind of approach. Now, compassion. Let's talk just a couple minutes about compassion training. And let's relate that to inflammation and stress biomarkers. Okay? So what basically we're talking about here is that this particular, there's been many studies like this. I'm involved with a study that's going on at the Max Planck Institute in Leipzig in Germany, where they're training people how to become more, enhance their compassion, bring it out more. Okay? And some of these interventions are 2 weeks. 2 weeks interventions. And what they're finding, okay, this is in the area of now of inflammation and stress. Okay? What they're finding, let's see if I can do this right. So it's this one was a 6-week training program, training compassion, helping people to kind of bring it out more. We all have compassion, but often it doesn't come out so much. So to bring it out more. And it was called Lojong. That's a Tibetan term. It literally means mind training, how to become more compassionate. Okay, that was the training program. And then, so the people got, there was a control group that didn't get this compassion training, and a group that did get it. Okay, 2 groups. And then then both groups got stressed. They intentionally stressed them. Okay, it's called the Trier social stress test. So the psychology people here know that. So this is just showing before a talk to a big audience, you get, kind of anxious. Okay, so And what they found was, okay, sorry for the technical stuff. I don't like this either, but I just do it just to give a point. And that is, these are the this is cortisol. So we're measuring cortisol, okay? Cortisone, basically, yeah. It's a measure of stress. And on the top line, these are statistically significant differences. On the top line are the controls that did not get the compassion training. And the ones that did get the compassion training are the lower lines, okay? And these are cortisol. So it tells us that people that had the compassion training who were then stressed showed less of a stress response compared to those that did not get the compassion training. Okay? And then inflammation. So this is a measure of IL-6, interleukin-6. It's a measure of inflammation in the body, okay? It's used a lot in research. And on the bottom here on the, sorry, on the, what is this, the x-axis, is how much meditation people were doing. And so what you see is the more meditation, the lower the levels, okay, of interleukin-6, which is a measure of inflammation. Okay? So showing that inflammation is reduced by compassion training. Forgiveness. Forgiveness is a central pillar. And forgiveness happens both ways. You know, there's forgiveness towards ourselves, which often we have trouble doing. Many of us have trouble doing that. And then there's forgiveness towards others. So to begin to learn that process of forgiving ourselves and forgiving others takes huge weights off our shoulders, opens up our chest, opens up our heart, and brings tremendous joy and happiness. It's an incredible thing. People often ask me, well, how do you do it? And I say, you just start with the small ones, start with the small hurts. Identify them first. Sometimes we're not aware. So identify the hurts that have been there, sometimes since we were kids. Okay. First, identify them. Once you identify them, just make a commitment that you're going to let them go. Okay. Let those hurts go. Okay. And that doesn't usually happen overnight. You have to work at it. You have to keep working at it. But make that commitment for health, physical, psychological, emotional, spiritual health. Make that commitment to yourself and then let go of those hurts, particularly towards yourself to start with. So self-forgiveness and then towards others. Doesn't mean the other person was right necessarily, okay? All it means is you're letting go of that hurt. Okay, you're no longer going to be the house for that hurt. Meditation, and very soon, maybe now, we're going to do meditation. If you don't mind, I'll take a sip of water. How many of you have ever meditated? Could you raise your hands? Whoa. Well, pretty much all of you. How many of you are involved with prayer? Raise your hands, please. Pretty much all of you. Fantastic. Wonderful, wonderful. What we're going to do is a simple technique, meditation technique. We're going to follow our breath. And people that do this regularly, 5 or 10 minutes every day, after some months or maybe years, find that inside minds become, and the heart becomes much more calm, much more peaceful. You know, most of us have all this chatter going on. It's like it doesn't stop, you know. When we fall asleep, the chatter's still happening. When we wake up, it's right there again. Okay? It kind of follows us around everywhere. Internal kind of chatter. We are multitaskers. I'm drinking and talking at the same time. We're multitaskers. Okay? So meditation really helps calm that down. It broadens our perspective. So we can actually see more with our minds, see more. you can make much better decisions. So now people in leadership positions are really turning to this stuff because it helps them make better decisions. The CEO of Google is all into this stuff. He's having all their employees learn this kind of stuff. Athletes are using it, professional athletes. I don't have time. I could tell you a lovely story from Mongolia about that, but maybe another time when we'll talk about that. But professional athletes are using these techniques to reduce the anxiety, make the mind more clear, broaden the perspective, therefore make better decisions in their athletic competition. And in all walks of life, the military is getting involved with this also. So officers, people making important decisions in the military, they're getting involved with this. Of course, we try to work on them very, kind of subtly, that maybe military does best when we don't have so much killing or something, but nevertheless, they want to improve their abilities. So we try to overlap those improved abilities with maybe less killing. So let's meditate, okay? Let's do that. Sit up straight. Let's do it with our eyes open, because most of you have been working today, and it's getting towards 6:30. You're probably hungry. You're probably tired a little bit. And if you close your eyes, might drift off, okay? So we'll keep our eyes open. But what we'll do is, rather than look straight ahead, we'll look down, just like I'm doing. Keep your heads up, but just with your eyes glance down like this, okay? And then our hands, what we're going to do is, I want you to put your left hand down, okay, like this. Put your left hand down, okay? And then I want you to put your right hand on top, like that. And then touch your thumbs together and pointing up. Thumbs together, pointing up like this, okay? And then just put that in your lap. So left hand down, right hand on top, thumbs up in the lap. Simple, okay? Now, I want you to take 3 deep breaths with your mouth closed, unless you have bad allergies or a cold, okay? And I want you to focus your mind on the sensation at the bottom of the nose as the air goes in and out. And we'll do that with 3 breaths so we can get used to it. And we can kind of identify that sensation at the bottom of the nose. So go ahead. Let's together take 3 deep breaths, mouth closed. Can you feel it? Bottom of the nose. When the air goes by, you feel that sensation? Yeah, I see a few heads nodding. That's what we're going to concentrate, okay, on. But we're not going to breathe deeply. We're just going to do normal breathing. Okay? Now, welcome. Your mind's going to get distracted, I can almost guarantee you, and it may be right away. Okay? Our job is to recognize I'm distracted, okay, and then bring the mind back to the breath. I do have one pocket, actually, and it's coming off the belt, so I'm going to put it, there's my kind of pocket. So recognize that you're distracted. Bring it right back to the breath. You may have to do that many times. That's meditation. I'm going to sit down and meditate with you. So please meditate. I'll take care of the time. It'll be about 5 minutes. We'll meditate together. Please meditate. Please stop your meditation. So that was a taste. Many of you, I think, do meditate. You raised your hands. This is something wonderful to do every morning. 5 minutes, 10 minutes, regular. Don't miss it. Anybody here not brush their teeth today? Raise your hand. We all brush our teeth, right? We become habituated. We have a habit. We feel it's good for us. It keeps our health, our teeth and gums healthy. So we do it. We were taught usually by our parents when we were quite small, and we just do it. We don't forget. Meditation is like that, but not just for healthy teeth and gums, but for a healthy body, healthy mind, healthy heart, to be a better person, more loving, more compassionate. So if you're interested, please take 5 or 10 minutes, do it in the morning. People tell me I don't have time. I don't have time. I'm busy. And actually, this maximizes our time, makes us more efficient, makes us feel better. That's something money can't buy. I'd like to say, just in kind of the last couple of remarks, I'd like to mention honesty, I'd like to mention integrity, and I'd like to mention trust. Okay? We now know that these qualities, not only do they make us better human beings, but they make us better healthcare providers. By being honest, by having integrity, by really showing a sense of concern, genuine, not false, a genuine sense of concern for our patients, they develop trust in us. And a lot of us know that because some of us here are not teenagers anymore. Okay? We've been to the doctor ourselves. Okay? And we know that when we can have some sense of trust for a doctor, it makes a world of difference. And now for the skeptics, the research is showing that in fact, integrity, honesty, trust, these qualities enhance healing. So these are very, very important. To remember these, we know about them, but we tend to forget in our busy days. And to reflect on these sometimes, and okay, maybe I shouldn't go that little white lie route. Maybe I should be more honest. Now, I'm not saying that for every patient all the time you tell them exactly what they have. I'm not saying that. What I do as a physician is I ask the patient, ask the family, what do they want to know? Particularly if it's a serious disease. And they tell me, Doc, I want to know. Or they say, Doc, you take care of it, don't tell me. Okay. Find out what they want. And if it's reasonable, respect it. Okay? Very, very important. Okay. Good. I have 15 minutes left. I'd like to open it up. Comments, questions, discussion, please. Now, I heard that Floridians are talkative, so I'm going to, please. Yes. Yes. Current vibration. Yep. You're going nuts, of course. I'm just joking. I'm joking. The question was sometimes when she meditates, she feels a current or a vibration. And she was kind of wondering what is this, what to do about it. Well, when we meditate like we just did, there are many types of meditation. Just want to say that. What we just did, following the breath, anything but following the breath is a distraction. Yep. Anything. Even if we have a communion with God, that's a distraction for this meditation. It doesn't mean it's bad. It just means our job during meditation is to focus on the breath. Okay? And I'm going to hazard a guess that God will be happy to do that. Okay? Because we're taking care of ourselves. If we're taking care of ourselves, we're going to be in a better position to take care of others. Okay? So just leave it. Please don't go there to the sense of vibration or current. Just let it be. Try to keep focusing in this meditation on the breath. It's neither good nor bad. It is. Thank you. Please, John.
One of the biggest challenges I see for us as healthcare providers. One of the biggest challenge that I see as healthcare providers is how fast we spin. We're in a society that spins very fast. We as physicians, with all the mega drivers in medicine, spin even faster. How do you begin to approach your physicians? Because this has been a passion of mine, my physician colleagues that have gone into medicine for the right reasons, but got distracted because of all the other stuff.
Yeah.
How do you begin to approach them to have the attitudinal changes that you're implying?
Yeah, that's kind of the $64,000 question, I think. No, it's wonderful. Yeah, I mean, many of us, I think, did go into medicine, at least us that are a little bit older. We went into medicine because we wanted to serve, we wanted to help. What I hear more about the younger folks, and I do teach in medical schools sometimes, is that there's a little bit more of an economic incentive. But nevertheless, I think many of us have gone in because we want to help people. And then we get caught up in the fast pace. We may get caught up in the material side with a home and a car and college education, et cetera, et cetera. And so we kind of lose sight of that initial reason why we went into medicine. I think just to reflect on that, number one, I think can be helpful. That, okay, why have I changed my attitude from my original reason to go into medical school, number one. Number two, to reflect on those times when we are kind of, our heart's more open, okay? We all have those times, and reflect on how it feels to us. So it's a little bit, sometimes it's called a selfish love or selfish compassion, because we're looking at how it makes us feel, okay? And I say that there's nothing at all wrong with that. Okay, it's not the highest level of love or compassion, okay? But we have to get there by steps. And that's a lovely step to take, to feel how good it feels when our heart's open, when we're helping, when we're loving, when we're compassionate. And then when you begin to kind of key into that, you want more of it. It's just like chocolate. Okay? And as you get, you want more of it, you do more of it. And then what slowly starts to shift, what I've found, and many people I know what happens is the selfish part of, feeling good when we're helping others, that becomes a little less important. Yeah? It's just seeing the other person smile or seeing the other person receive some benefit, that's enough. Okay? So we begin to make one more step on our level of compassion. And eventually, and the principle is this, eventually external circumstances will have less impact or influence on us. Okay? So now we help someone, we expect something. We expect a thank you. We expect a check maybe. We expect a smile. Okay? But with people that are sick, and particularly people that are just not feeling well, those things may not come. They may feel it, may or may not, but they may not express it. Okay? So the fact that we're all the same, okay, the fact that we're all the same from this perspective, okay, which is we all want to be happy. We all want to be well. None of us want to hurt. And in that way, we're all the same. Of course, there are many differences, right? I mean, I'm a Buddhist monk, and on and on. I'm a man, you're a woman, I'm old, you're young, and da-da-da-da-da. All these differences, and we concentrate often on the differences. But in fact, there is this commonality, a human commonality of wanting to be well and not hurt. All have that deep down. And the more we recognize and remember that, then to practice love and compassion just because we all want to feel well begins to shift our attitude more towards a pure form of compassion. So these things don't always happen. They're not easy. I mean, I am a physician. I'm a practicing physician. But it's very part-time. I don't have the kind of stress you guys have working in the hospital. I used to. I mean, I know I used to be there. So it's easier for me to say. But nevertheless, these are very important things. And particularly as we get a little bit older, we recognize, the fame that comes, from being a good doctor, the material benefits that come from being a good doctor. Those things, they're wonderful, but sometimes something's missing. Okay? And what fills in that missing stuff is open in the heart. And by helping others and doing it in gradually in a more pure form, not expecting anything in return, and not, saying, I'm going to help this one because I like this one. I'm not going to help this one because I don't like this one. Not like that, but helping everyone, okay? Going in that direction, then our life becomes much more meaningful and rich. Please.
From an acute care perspective, hospitalization, any studies that indicate shorter lengths of stay, fewer pain meds, less pressing of the call button for folk who meditate as opposed to those who don't?
Pain, certainly, very good evidence. John Kabat-Zinn, who's a dear friend of mine, he kind of, brought about this whole, Time magazine last month on their feature said, mindful revolution. That's what Time magazine said. And the whole kind of person who brought that all about is John Kabat-Zinn. For 30 years, he ran the chronic pain clinic at the University of Massachusetts. People had gone everywhere with their back pain, pelvic pain, headaches, etc., and got no relief. And they came to his clinic. And he taught them this kind of stuff, this meditation. They call that MBSR, mindfulness-based stress relaxation. He didn't even use the word meditation. And they taught people, and people that stayed with the program, they had to meditate 45 minutes a day to stay with the program. 2-week intensive thing, and then 45 minutes, then refreshers. Those that stayed with the program, they said that they did much better. If you talk to those people, and this is over 30 years, lots of people, if you talk to those people and you say, well, is your pain gone? They say, no, still got the pain. You kind of scratch your head. Well, what do you mean? You say you're better, but you still have the pain. What they say is they've reframed it. They no longer think pain. They've learned to be in the moment and follow the sensation in their body or in their heart or their mind, okay, where the pain is, and follow that sensation moment to moment. They don't label it pain. When we label it pain, the concept, then fear, something's going to break, all that stuff comes, and the sensation or the experience, the experience of pain is much greater. So it definitely works in terms of pain. In terms of hospitalization stay, I don't know. There are some great studies some years back with women with breast cancer. And all the women got what was ever, required for their stage and type of breast cancer. So, surgery, radiation, chemotherapy, or combination. What was different about the two groups is one group got additionally TLC, tender loving care. Psychologists went to them regularly, flooded them with love. Okay? In the group that got the TLC, the love, those women, as you can imagine, on their satisfaction questionnaire measures, scored higher, more life satisfaction. You'd expect that. They also lived longer. It's been replicated. It's very good research. Yeah. Let's see. We've got a few more minutes, so if you have a few more questions, please.
Can you talk a little bit about the culture of healing, the culture of medicine that you've experienced in the different parts of the world that you've lived in?
Yeah, it's a lovely question. I'm going to frame this around death and dying, can I? Yeah. In the Tibetan Buddhist community, there are people that spend their lives meditating, sometimes up in the mountain, very simple, primitive conditions, not much good food, not much good health care. And when they're diagnosed with cancer, for example, they smile. They say they're very happy. They don't want to die, and they're not suicidal, but they're very happy. Why? Because their death process is going to go slowly. Okay? And they want to practice during the time they're actually dying. So from a Buddhist perspective, death is different than our perspective as modern medical people. Okay? There are actually 8 stages of death. And the 4th stage is what we call, I say we, I mean, I kind of do both, but as physicians, okay, is the 4th stage, 4 out of 8. So from a Buddhist perspective, the person hasn't died yet. And that stage is when the movement stops, so-called kinetic energy. So there's no more circulation of blood, no blood pressure, no pulse, and no respiration, no breathing. And if you were to do an EEG, electroencephalograph, no brain activity, a flat, so-called flatline EEG. Okay. That's the 4th stage. We say the person has died. From a from a Buddhist perspective, not Tibetan, Buddhist perspective, the person hasn't died. The mind still goes successively through subtler stages and comes to the most subtlest. And the person that's been meditating many years, he or she, during that death process, will meditate on these 8 stages. There are internal visions that everyone goes through. And the meditator will, bring that natural process in with their meditation. When they come to the last stage, when people finish the 8th stage, they die. And from a Buddhist perspective, the subtle mind exits, usually through the crown, finds another rebirth, reincarnation. That's a Buddhist understanding. These people that are meditating, they will stay in that state for days, often weeks. No blood pressure, no pulse, no heartbeat, no breathing, flatline EEG. They're fresh, bodies haven't decomposed, no bad smell. In fact, often a very subtle, faint, kind of flowery, almost fruity kind of scent. I've experienced it several times. I mean, not me, but I've been. They're supple, no rigor mortis, they're very flexible. Skin looks alive, looks lovely. There's no the signs that you see in a corpse. Okay, it's quite amazing. It's called tuktam. It's a Tibetan word that means sacred mind. Sacred mind. Okay, and now actually researchers, good ones. Davidson's group, Richard Davidson's group from University of Wisconsin-Madison, some of the folks that studied me. I was also studied in Princeton. But they're doing the work now on the people going into this tuktam, trying to figure out what's happening. So I just wanted to mention that. And these people then, to get back to your question, are, their experience of going through the death process is joy. No fear, no regret. There are other people that aren't these serious career meditators, okay, but they have a deep belief in reincarnation, that this isn't the end of the story when they die, and often they don't have regret, not depressed. I've seen this many times. So this is more of a cultural thing. Partly it's religious, but partly it's cultural. And it's very, very interesting. So it kind of, when you see this, I don't know what I'm going to go through when I die, but I kind of suspect that it won't be as difficult had I not had these kind of experiences. Of course, I don't know what the circumstances will be, but, it brings a sense of ease. And I think that's true generally with religion also, a sense of ease and kind of some way being protected maybe and cared for. But I've certainly seen that in the Buddhist communities.
I believe that I read, I think, by Sharon Salzberg, that meditation based on loving kindness has, in particular, beneficial cardiovascular effect. Can you expand on that, please?
Yes, Sharon's a good friend of mine. I think there's a lot of truth in that. And, you know, Dr. K is a premier cardiologist. He knows very well the opposite. We call so-called type A personality people that are angry a lot of the time, that are really uptight, just tense a lot of the time. Those people tend to get more heart attacks and die early. Okay? So just from that, it makes sense that the opposite is probably true. That if we're less angry, more relaxed, certainly our blood pressure will be lower, and you know, just from that, we'll have a healthier life and live longer. There is some research that begins to establish that. I don't know the particular studies, but I know there is some research that is corroborating that. I can't tell you any more detail. Sorry. Please, yes.
Have there been any studies or surveys or evaluations to see if there's a difference in the health between Tibetan monks and Tibetans who are not monks?
Right, good question. You know, one of the problems is that, you know, the Tibetan monks that are meditating, they don't take care of themselves much. They don't have a, you know, they're more keyed into this mind, this continuum of mind that continues and was before, rather than the body that's very temporary. They do see it really, they really do see it as a changing of old clothes, not just as a, you know, I mean, they believe that. So they tend not to take care of themselves so much. They don't want to spend their time in the hospital, you know. They'd rather be doing their practice, helping others, and when they die, it's okay. So therefore, it's a little hard to compare the Tibetan monks or Tibetans who are meditating and not meditating. Because the ones that are not meditating have families, they're going to go to the doctor, and they're now taking care of themselves well. They've got a family, you know, all that. So I don't, it's hard to compare those groups. If you look at happiness, the happiness quotient, wow. I mean, the difference is dramatic. One of my teachers, close teachers who died about 10 years ago, I mean, he smiled almost all the time. And, you know, I mean, some people have polite smiles, or, you know, maybe they want something from you and they smile. I mean, this was genuine smile. I mean, you just automatically smiled. He was so loving, incredible. So on a happiness quotient, huge difference. Yeah. And that it's not just happiness for themselves, but they're just, it ripples out. That's one thing that happens naturally. It affects people around them. And the other thing is their lives are just dedicated to service. They're just helping other folks in any way they can. Yes, please. I think, yes, please.
What's exactly transcendental meditation? Is it the same thing?
Yeah, it's different, and I don't know much about TM, so I'm not a good one to ask that question. I don't do TM, transcendental meditation, myself. It's not part of the Buddhist tradition. And you'll have to find someone that has more experience than myself to answer that question. Sorry.
Is the rate of Alzheimer less in Buddhist monks than others?
Yeah, that's a really good question. I don't know of any good studies. My guess is yes. I don't see Alzheimer's disease in older Tibetan monks. Some of them have had stroke, and their cognition is clouded because of that. But I don't see Alzheimer's in older, and I see a lot of older monks. But I don't know of any good research or studies on that. Also, much less schizophrenia. We occasionally see somebody with schizophrenia in the community, but it's extremely rare. Please.
You've described meditation as something that happens, I think, in the quiet. That's what we think of. I'm wondering about meditation with something active, as in laughter. You know, thinking about the processes going on, or swallowing, or something else that's a little more active.
Yeah, well, if you've ever been to Delhi, particularly South Delhi, about 5 in the morning, you'll hear, if your window's open, because it's usually hot there, you'll hear, ha, 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 ha. They get together in groups. You know, every whatever day, I don't know what day, and Sundays I think, and they get together and they laugh in the park, and people come and keep doing it and doing it. Well, I was just going to say I don't call that meditation, but it's wonderful for health. You asked for an active meditation. What I teach a lot is this. I'll do it for you. Let's see if I can stand somewhere. Maybe I'll stand here. You can all kind of see me. This is an active meditation. Walking meditation, where you're totally focused on your feet, nothing else. Now, if you're talking about active, meaning dancing, not quite that, but it is some kind of movement, yeah. Walking meditation is lovely. Try it sometime. Just walk very, very slowly, you know, and concentrate on your feet, particularly the heel, the ball, and the toes as you know, each time as you take a step. And just concentrate on that. And do that for 10 minutes or 20 minutes, and you come out incredibly refreshed. I think we've gone over time. I apologize for keeping you late. I'd like to show you, I think there's a last slide, is there? Let's see what I do here. Okay, yeah, just a couple things. I'm on Facebook. It's not a chat Facebook. It's more of an educational. So if you're interested, just my name. And then we have this institute, which is a nonprofit institute. It's based in California, although our bank account is here in Orlando. Altruism in Medicine Institute. So the website is Altruism Medicine. Notice the double M.org. Okay, and our purpose is to improve compassion in healthcare providers. That's what we're all about. And then in Japan, so I'm the founder and executive. I don't know, executive. What am I? Executive director? No, of this one. And then I'm the founder of the Human Values Institute. And that's the website, humanvaluesinstitute.org. And there's an English. This is in Japan, in Tokyo. And there's an English companion website there. And then Mind and Life Institute, which is www.mindandlife.org, is this group that was mentioned earlier. And this was formed about nearly 30 years ago between His Holiness the Dalai Lama, Francisco Varela, a neuroscientist, also a Buddhist, and an entrepreneur, Adam Engel, and is still going today, become extremely popular. And once or twice a year, there are these dialogues between scientists, often physicists, and the Dalai Lama. Sometimes psychologists, sometimes medical doctors, other kind of scientists. And thank you very much.